It was 3:47 a.m. when 7-year-old Marcus Washington started coughing up blood. His mother, Janet, a night shift nurse at another hospital across town, knew immediately this wasn't just another cold. She scooped up her son, wrapped him in a blanket, and rushed to St. Catherine's Medical Center, the most prestigious hospital in the city. The emergency room was eerily quiet at this hour. Janet carried Marcus through the sliding glass doors, his small body trembling against her chest. The reception desk sat a young woman with blonde hair tied back in a perfect bun, typing lazily on her computer. "Please, I need help," Janet said, her voice tight with worry. "My son is coughing up blood." The receptionist looked up with barely concealed annoyance. Her eyes quickly scanned Janet's appearance, the simple jeans, worn sneakers, and tired face of someone who worked multiple jobs just to get by. "Do you have insurance?" the receptionist asked, her tone cold and professional. "Yes, but please, can someone just look at him first? He's only 7 years old." The receptionist sighed dramatically. "Take a seat. Fill out these forms. Someone will call you when a doctor is available." Janet took the clipboard with shaking hands and found a seat in the corner. Marcus had stopped coughing, but his breathing was shallow and labored. She filled out the forms as quickly as she could, her handwriting messy with panic. 30 minutes passed. Then an hour. Marcus's condition was getting worse. Janet approached the desk again. "Excuse me, it's been over an hour. My son really needs to see a doctor." "Ma'am, I told you someone will call when available. Please return to your seat." "But he's getting worse." "Please, I'm a nurse myself. I know this is serious." The receptionist's expression hardened. "If you don't like the wait time, you're free to go to the county hospital." Janet felt the sting of those words, but swallowed her pride. The county hospital was 2 hours away, and Marcus didn't have that kind of time. She returned to her seat, holding her son closer. Finally, after 2 hours, a nurse called Marcus's name. Janet practically carried him into the examination room, where they waited another 40 minutes before Dr. Richard Steinberg entered. Dr. Steinberg was in his late 50s, with silver hair and an expensive watch that caught the fluorescent light. He had been the head of pediatric surgery at St. Catherine's for 15 years and had a reputation for being brilliant but difficult. He glanced at the chart without looking at Marcus. "What seems to be the problem?" he asked, his voice carrying the authority of someone accustomed to being the smartest person in the room. "He's been coughing up blood for hours," Janet explained. "His breathing is getting worse, and he's running a fever." Dr. Steinberg finally looked at Marcus, but his examination was cursory at best. He listened to the boy's chest for perhaps 30 seconds, checked his throat with a flashlight, and then stepped back. "It's probably just a respiratory infection," he said dismissively. "Kids get them all the time. Give him some over-the-counter cough medicine, and he'll be fine." Janet stared at him in disbelief. "Doctor, with all due respect, I'm a registered nurse. This isn't just a cold. He's been coughing up blood. That's not normal for a 7-year-old. Dr. Steinberg's expression grew cold. "Are you questioning my medical judgment? I'm asking you to please examine my son properly. Something is seriously wrong." "Ma'am, I've been practicing medicine for 25 years. I think I know the difference between a cold and something serious. Your son has a minor respiratory infection. Take him home, give him fluids, and rest. If you're still concerned, make an appointment with his pediatrician next week." "Next week?" Janet's voice rose. "Doctor, look at him. Really look at him. He can barely breathe." Dr. Steinberg glanced at his watch. "Mom, it's nearly 6 a.m. I've been working all night. I don't have time for this. Your son has a cold. That's my professional opinion. Please just run some tests. An X-ray, blood work, anything. Tests cost money. Does your insurance cover extensive diagnostics for minor illnesses? I don't think so. This is exactly what's wrong with healthcare today. Everyone wants expensive tests for simple problems. Janet felt tears welling up in her eyes, but she pushed forward. If money is the issue, I'll pay for the tests myself. I'll figure it out. Please, he's my only child. Dr. Steinberg's patience had clearly run out. Ma'am, I'm going to be very clear with you. Your son has a common respiratory infection. I'm not ordering unnecessary tests because you're being paranoid. Now, I have real emergencies to attend to. Take this prescription for cough syrup and go home. He handed her a hastily written prescription and turned toward the door. What real emergencies? Janet asked, desperation creeping into her voice. The ER is empty. Dr. Steinberg stopped and turned back, his face now showing open irritation. Are you seriously questioning how I prioritize my patients? Listen, lady, I don't know what kind of treatment you're used to at whatever clinic you usually go to, but this is a serious hospital. We don't waste resources on every anxious mother who brings her kid in for a sniffle. The words hung in the air like a slap. Janet realized in that moment that Dr. Steinberg had made assumptions about her from the moment he walked in. He saw a young black woman with a sick child and assumed she was overreacting, assumed she couldn't afford proper health care, assumed she didn't understand medicine despite her clearly stating she was a nurse. I understand you're tired, doctor, Janet said quietly, but I'm begging you to please reconsider. I know my son. This isn't normal. Ma'am, your son has a cold. End of discussion. The nurse will discharge you. Dr. Steinberg left the room, leaving Janet alone with Marcus, who had started coughing again, this time bringing up more blood than before. The discharge nurse, who entered 15 minutes later, was kind but clearly following orders. Here's your discharge paperwork, she said gently. The doctor prescribed some cough medicine. Make sure he gets plenty of rest and fluids. Janet looked at the young nurse and saw sympathy in her eyes. What do you think? She asked quietly. The nurse glanced toward the door and lowered her voice. I'm not allowed to contradict the attending physician, but if it were my child, I might get a second opinion. Janet nodded, understanding the message. She gathered Marcus in her arms and left St. Catherine's Medical Center, feeling more frightened than when she had arrived. But Janet Washington was not going to give up on her son. She drove straight to Children's Hospital downtown, where Marcus was immediately admitted after the emergency room doctor took one look at him. How long has he been like this? Dr. Sarah Chun asked as she examined Marcus thoroughly. Since about 4 a.m., but it's been building for a few days. And you took him somewhere else first? Janet nodded, feeling embarrassed. St. Catherine's. They said it was just a respiratory infection. Dr. Chun frowned as she continued her examination. I'm ordering immediate blood work, chest x-rays, and a CT scan. This child is seriously ill. Within 2 hours, the tests confirmed Dr. Chun's suspicions. Marcus had pneumonia that had developed into a potentially life-threatening condition called empyema, an infection in the space between his lungs and chest wall. Without immediate treatment, it could be fatal. Mrs. Washington, Dr. Chun said, gently, your son needs emergency surgery. The infection has progressed significantly. We need to drain the fluid from around his lungs immediately. Janet felt the world spinning around her. How long does he have? We need to get him into surgery. Within the next few hours. This condition can deteriorate very quickly. As Marcus was being prepped for emergency surgery, Janet called the one person she hadn't wanted to involve, her ex-husband. David Washington. David and Janet had divorced 3 years earlier, not out of lack of love, but because their careers had pulled them in different directions. David had been appointed as the Minister of Health just 18 months ago, making him one of the youngest cabinet members in the country's history. Their relationship remained complicated but cordial, united by their love for Marcus. David. It's Janet. Marcus is in the hospital. It's serious. Within 40 minutes, David Washington arrived at Children's Hospital. Despite being one of the most powerful people in healthcare policy, he looked like any other terrified father as he rushed through the hospital corridors. How is he? David asked, embracing Janet briefly. He's in surgery. They said if we had waited much longer. Janet's voice broke. What happened? How did it get this bad? Janet told him everything. The dismissive treatment at St. Catherine's, Dr. Steinberg's refusal to run tests, the assumptions made about their family based on appearance and perceived economic status. David listened in silence, his expression growing darker with each detail. As Minister of Health, he had heard similar stories countless times. Healthcare disparities, unconscious bias in medical treatment, the different standards of care for different communities. But hearing it happen to his own son, to the woman he still cared deeply about, ignited something in him. Dr. Steinberg refused to examine Marcus properly? David asked, his voice carefully controlled. He looked at him for maybe 2 minutes total. He assumed it was just a cold without running any tests. When I told him I was a nurse, he basically dismissed my concerns entirely. David pulled out his phone and made a call. This is Minister Washington. I need you to pull the complete medical records and security footage from St. Catherine's Medical Center for last night. Patient name Marcus Washington, approximately 4 to 6 a.m. Yes, immediately. The surgery took 4 hours. When Dr. Chun finally emerged from the operating room, she found David and Janet holding hands in the waiting room. The surgery was successful, Dr. Chun said with a tired but relieved smile. We were able to drain all the infected fluid. Marcus is stable, and with proper treatment, he should make a full recovery. Janet collapsed with relief, but David's expression remained grim. Doctor, what would have happened if he hadn't received treatment today? Dr. Chun hesitated. Minister Washington, I don't want to alarm anyone unnecessarily, but this condition can be fatal if left untreated. Your son was very sick. A few more hours of delay could have resulted in sepsis or respiratory failure. David nodded slowly. And the doctor at St. Catherine's, who said it was just a cold. I can't comment on another physician's diagnosis without seeing their examination notes. But I will say that any emergency room doctor should recognize the signs of severe pneumonia in a child. The symptoms Mrs. Washington described, coughing up blood, labored breathing, fever, those are clear indicators for immediate diagnostic testing. That evening, as Marcus slept peacefully in his hospital bed with Janet by his side, David made another phone call. I want a full investigation into the patient care standards at St. Catherine's Medical Center, he told his chief of staff. And I want it completed by tomorrow morning. Sir, that's quite fast for a full investigation. My son almost died because a doctor couldn't be bothered to properly examine a sick child. I want to know if this is an isolated incident or part of a pattern. And I want to know tonight. By morning, David had a complete report on his desk. What he read made his blood run cold. St. Catherine's Medical Center had a documented pattern of providing substandard care to minority patients, particularly in the emergency room. Over the past 3 years, there had been 17 formal complaints filed against the hospital for discriminatory treatment. Dr. Steinberg specifically had been named in 9 separate incidents involving minority patients, ranging from rushed examinations to outright refusal of care. Asterisk, more damning was the security footage from the night Marcus was brought in. David watched his ex-wife pleading with Dr. Steinberg to properly examine their son, saw the doctor's dismissive body language, witnessed the clear bias in the treatment their family received. But what truly enraged David was discovering that, just 30 minutes after dismissing Marcus, Dr. Steinberg had spent over an hour with a white family whose child had similar symptoms. Ordering multiple tests and providing comprehensive care. David made a decision that would shock the entire medical community. At 10 a.m. the next morning, David Washington, in his capacity as Minister of Health, arrived at St. Catherine's Medical Center with a team of health inspectors and legal representatives. Dr. Steinberg was in the middle of his morning rounds when he was summoned to the administrator's office. He entered to find David Washington sitting at the head of the conference table, surrounded by hospital executives who looked terrified. "Dr. Steinberg," David said calmly, "I believe you met my son Marcus last night." Dr. Steinberg's face went pale. "Minister Washington, I didn't realize... You didn't realize what? That the sick child you dismissed without proper examination was my son? Or that the woman you treated with such disrespect was a registered nurse who knew exactly what she was talking about?" Dr. Steinberg started to speak, but David held up his hand. "Let me be very clear about what happened last night. You refused to properly examine a critically ill 7-year-old boy. You dismissed his mother's concerns despite her medical training. You made assumptions about our family based on race and perceived economic status. And because of your negligence, my son nearly died." The room was silent except for the sound of Dr. Steinberg's heavy breathing. David continued, "As Minister of Health, I've conducted an emergency review of this hospital's practices. What I've found is a systematic pattern of discriminatory care that puts lives at risk. Dr. Steinberg, your medical license is being suspended immediately pending a full investigation. You will no longer practice medicine in this country." Dr. Steinberg stood up abruptly. "You can't do this. I'm one of the most respected pediatric surgeons in the city. I've saved thousands of children." "Have you?" David asked quietly. "Or have you only saved the children you deemed worthy of your attention? How many Marcus Washingtons have walked through these doors and been turned away because they didn't fit your definition of deserving patients?" David stood and addressed the room. "St. Catherine's Medical Center is being placed under federal oversight effective immediately. Your emergency room will be temporarily closed pending a complete restructuring of patient care protocols. Every member of your medical staff will undergo mandatory bias training and review." The hospital administrator, a nervous man in his 60s, finally found his voice. "Minister Washington, surely we can work something out. Dr. Steinberg has been under tremendous stress. Perhaps additional training. Mr. Phillips, your hospital has received 17 formal complaints about discriminatory care in 3 years. 17 families who trusted you with their loved ones and were failed because of prejudice and bias. This isn't about stress or training. This is about fundamental human decency." David turned back to Dr. Steinberg. "You want to know what really disturbs me? It's not just that you failed my son. It's that after you dismissed him, you spent over an hour providing comprehensive care to another child with similar symptoms. The only difference was the color of their skin." Dr. Steinberg's shoulders slumped. I never meant for it to be about race, but it was," David said simply. "And intention doesn't matter when a child's life is at stake. The little boy fighting for his life in Children's Hospital right now doesn't care about your intentions. His mother, who had to watch her son suffer because you couldn't see past your own biases, doesn't care about your intentions." David gathered his papers and prepared to leave. "Dr. Steinberg, you took an oath to first do no harm. But harm isn't just about what you do. It's also about what you fail to do. Your failure to see my son as worthy of proper medical care was harm. Your dismissal of his mother's expertise was harm. Your assumptions about our family were harm." As David reached the door, Dr. Steinberg called out, "What about my career? My family depends on me. I have children of my own. David turned back one final time. Then I hope they never have to experience what my son went through last night. I hope they never have to face a medical professional who sees their race before their humanity. I hope they never have to beg for basic compassion from someone who took an oath to help. The investigation into St. Catherine's Medical Center revealed a culture of systemic bias that had been allowed to flourish for years. 17 doctors had their licenses reviewed, with 5 facing permanent suspension. The hospital's entire emergency room staff was replaced, and new protocols were implemented to ensure equitable care for all patients. Dr. Steinberg's medical license was permanently revoked after the investigation revealed a pattern of discriminatory care spanning his entire career. The prestigious surgeon, who had built his reputation on saving children, had been selectively choosing which children deserved to be saved. The story made national headlines, not because David Washington was a powerful government official, but because it highlighted a crisis that affected thousands of families across the country. The hashtag Marcus Washington began trending as other families shared their own stories of medical discrimination and bias. 3 weeks later, Marcus Washington was discharged from Children's Hospital with a clean bill of health. Dr. Chun had become a family friend, and the hospital staff had fallen in love with the brave little boy who had survived not just a life-threatening illness, but a healthcare system that had initially failed him. David and Janet used the experience to launch a national initiative focused on eliminating healthcare disparities. The Marcus Washington Foundation became a powerful voice for equitable medical care, working to ensure that no child would ever again be denied proper treatment because of their race, economic status, or zip code. St. Catherine's Medical Center was eventually sold to a nonprofit organization committed to community health care. It was renamed Community Care Medical Center and became a model for equitable healthcare delivery, treating over 50,000 patients in its first year under new management. Dr. Steinberg never practiced medicine again. He eventually became a patient advocate, working to educate medical professionals about unconscious bias in healthcare. It was a path toward redemption that came too late for the patients he had failed, but one that might prevent future tragedies. The real victory, however, was simpler and more profound. Marcus Washington grew up healthy and strong, with parents who had fought the entire system to ensure he received the care he deserved. He learned early that sometimes the world wouldn't see his worth immediately, but that he had people who would fight for him until it did. Years later, when Marcus would face other forms of discrimination and bias, he would remember the night his father stood up to an entire hospital system for him. He would remember that love looks like action, that justice sometimes requires disrupting comfortable systems, and that every child deserves to be seen as worthy of care, compassion, and respect. This story isn't just about one family's fight against medical discrimination. It's about the thousands of families who face similar battles every day, often without the resources or power to demand justice. It's about the healthcare providers who perpetuate bias and the ones who fight against it. It's about the systems we build and the choice we all have to either accept inequality or work to dismantle it. Most importantly, it's about remembering that behind every statistic about healthcare disparities is a real child, a real family, real human beings who deserve to be treated with dignity and respect, regardless of what they look like or where they come from. Marcus Washington survived because his parents refused to accept substandard care. But survival shouldn't depend on having powerful parents or the resources to fight back. It should be a basic human right, guaranteed to every child who walks through a hospital door seeking help. The changes that followed Marcus's story were significant, but the real change happens one interaction at a time, one patient at a time, one healthcare provider at a time, choosing to see the humanity in every person they serve. That's the legacy Marcus Washington's story left behind. Not just policy changes or hospital reforms, but the reminder that healthcare is fundamentally about human compassion. And compassion doesn't see color, status, or economic background dotted. Sees only the sacred responsibility to heal, to help, and to honor the trust placed in those who hold the power to save lives. In the end, that's what medicine is supposed to be about. And sometimes it takes the near tragedy of one child to remind an entire system of that fundamental truth.